I'm Dr. Summer Gutschow. I'm a general dentist in Omaha, Nebraska, and today I'll be sharing with you some of my best practices in transitioning to an ergo loop. In this video, I'm going to show you how I would work with my ergonomic loupes on the lower right area, the lower right quadrant. One thing as a right-handed dentist with my traditional loupes, it's fast, it's easy. I use direct vision almost 100% of the time, or I did when I was using traditional loupes. So this is kind of what my position would look like. I'd be looking at the tooth, maybe retracting here. Let's say I'm doing a crown on number 30. This is what I would look like preparing that tooth from my 12 o'clock position. And then if I'm going to come over here and use some direct vision on the buccal of the tooth, it'd look something like this. Kind of hunched over, pushing my jaw forward, my neck is tipped in, but I can see that tooth really nice and easy, and I can transition from a posterior tooth to an anterior tooth pretty easily, but notably it is harder on my neck. Now I'm going to show you how I would sit and position the patient with an ergo loop. I think the most notable thing is that your working distance is going to be a little bit further away. You should be upright, but you have to make sure that you have the patient in the right spot so that the tooth is in focus. So you can do one of two things. You can move the patient away from you, or you can sit your chair up just a little bit taller. I like to split the difference. I like to bring the patient down just a little bit further, and then I like to pop my chair up maybe just an inch or two. You'll notice that no, my legs are not at a 90-degree angle anymore, but I'm 4'11". My legs are never at a 90-degree angle. You're going to figure out what is comfortable for you. So now with using my ergo loop, I'm going to have Rebecca turn to the right here just a little bit. That's great. And now I have a direct sight here to number 30. And then if I want to work on the anterior teeth, I'm going to have to either move Rebecca or I'm going to move myself to be able to see those in focus. And I choose to just rotate just a little bit here, and now they're perfectly in focus. With a traditional loop, we don't necessarily make the most ergonomic choices with our body. We do what we have to do to be able to see. We lean, we bend, we go where we need to go to be able to see. And with an ergo loop, I mean, yes, it does put your neck in a really nice posture, and it makes it more difficult to cheat. But if you are, you're running behind in your schedule and you want to move a little bit more quickly, you can still cheat with an ergo loop. I can lean to the side here just like this, and I can see that anterior tooth rather than spinning my chair around or moving the patient. I can still lean in and see number 31, number 30, number 29. I'm bending at the hips though now instead of contorting my neck one direction or another.